my name is Brooklyn Druckey, and today I'll be talking about bipolar disorder. Well, what is bipolar disorder? I always thought that bipolar disorder meant something else, but I will be telling you what it actually means. So what is bipolar disorder? Bipolar disorder is a mental illness that causes shifts in a person's mood, energy, activity levels, and concentration. People with bipolar disorder often experience periods of extremely up, irritable, or energized behavior and very down, sad, indifferent, or hopeless periods. For example, this is when a person could be super happy and then flip a switch and be super sad. What are the symptoms of bipolar disorder? People that have bipolar disorder have excessive happiness, hopefulness, and excitement. They have sudden and severe changes in mood. This can happen in a flip of a blink, just like that. This can also go from going from being super joyful to being angry, rapid speech and racing thoughts, increased energy, and less need for their sleep. So, bipolar disorder is broken into 3 different types. So first, you have bipolar 1, bipolar 2, and cyclophymatic disorder. Bipolar 1 is when people have experienced 1 or more episodes of mania. Bipolar 2 is when people have experienced depressive episodes or hypomanic episodes. And cyclomatic, this is when people have chronically unstable mood states. So that graphic shows when people are really happy and then when they are just like kind of okay and then very sad. So who is most likely to get bipolar disorder? People that are most likely to get bipolar disorder is from ages 15 to 24. Bipolar disorder affects approximately 5.7 million adult Americans, or about 2.6% of the US population. Individuals with pediatric onset bipolar disorder have a longer course of illness, more mood episodes, and significantly worse family functioning. Bipolar disorder affects so many people. This disorder affects people worldwide, including 1 to 2% of our global population. Bipolar disorder affects approximately 5.7 million adult Americans, or about 2.6% of the US population. For example, you walk by people at your job, school, and the store affected by this disorder. For example, if you are at a function and you meet some new people and then your moods start acting up and they don't know, they could take a whole different way than you have it. So there is treatment and medication for this disorder. The main treatment is medication and psychotherapy. Main medication are mood stabilizers, antipsychotics, and antidepressants. People can use mood stabilizers to prevent the extreme mood shifts. People can use antipsychotics to help with the maniac and mixed episodes, and people can use antidepressants to treat depressive episodes. So how long does each episode last? These periods last from days to weeks, and they are called mood episodes. Mood episodes are categorized as manic, hypomanic episodes when the predominant mood is intensely happy or irritable, or depressive episodes when there's an intensely sad mood, or the ability to experience joy or pleasure disappears. So the cause of bipolar disorder. The whole cause, scientists really don't know what the cause for this is, but there is a lot of factors that could come into play. Genetics play a huge role on this disorder. It is shown that people with the family history of disorder are at a higher risk of developing this disorder. If a person has had trauma, stress, financial difficulties, loss of a loved one, or drug or alcohol abuse, there is a chance that this will come into play. This is very hard sometimes for people because they might not know they have it and they actually are diagnosed. So where did this name originate from? This used to be recognized as the manic depressive illness or manic depression. But over time, this changed to be called bipolar disorder. They did this because it allows the scientists to be more clear when they are diagnosing people with bipolar disorder. What to do if your family member has this disorder? Having a good support system helps a ton. Getting help from the family, friends, and professions will help them. Being on a regular sleep schedule and balancing a regular diet will also help with this disorder. Facts about this disorder. Typically appears in the late adolescence or early adulthood. With proper treatment, individuals with bipolar disorder can live fulfilling and productive lives. People with this disorder may experience significant challenges in their relationships, work, and daily functioning. So my conclusion for this presentation is it is a very challenging mental health condition. It will affect your mood, energy levels, and daily life. This even impacts people and their families. But if you get the right medication, counselors, therapy, and trusted adults, you should be just fine, and one can live with this disorder. Thank you for watching my presentation, Bipolar Disorder.